Hello everyone, I hope all of you are doing well. Ramadan Kareem to all of you. My name is Saddam Adam. I've graduated from University of Bahrain 2021 and I've done a Master of Human Anatomy National University. I will be with you in the module of GIT Anatomy and Histology. By the end of this session, you will be able to define oral cavity, extent and subdivisions, tongue, external features, muscle and actions, innervation and blood supply and lymphatic drainage of tongue, and also we will discuss some clinical correlations. Oral cavity. Firstly, we have oral fissure as you see here number 1, and we have angle of the mouth, philtrum as you can see. Boundaries of oral cavity. Oral cavity extends from oral fissure to the oropharyngeal isthmus. That communicates with the pharynx posteriorly. You can see here soft palate, uvula, palatoglossal fold, and oropharyngeal isthmus posteriorly. Boundaries of oral cavity. In the roof of oral cavity, you will find the palate. It's divided into soft palate and hard palate, and the floor is covered or occupied by tongue and mucosa and supported from below by gynohyoid and mylohyoid muscle. Mylohyoid is oral diaphragm. On the lateral wall, an anterior wall is formed by cheeks and lips. Oral cavity is divided into two parts. We have vestibule and have oral cavity proper. The vestibule is the space between cheeks and gums outside, and from inner side this is oral cavity proper, area inside the teeth and gums. As you can see here, the oral cavity proper, and here this is vestibule. V is the vestibule, O is the oral cavity proper. This cross-section subdivision, as I can see, external lips and cheeks, this is a vestibule, and oral cavity proper internally between the teeth and gums. Again, the space between lips and cheeks from outside, this is the vestibule, and the space from inside between the teeth and gums internally, this is the oral cavity proper. Soft palate, uvula, palatoglossal fold, and palatine tonsils. The roof of oral cavity, as I said, is formed by hard palate and soft palate. The hard palate itself is formed by two bony parts, palatine process of maxilla in front and horizontal plate of palatine bones behind. This is the hard palate. Continue backward with the muscular part is called soft palate, and soft palate end with the uvula. Soft palate itself is formed like 5 of group of muscle, tensor villi palatini, levator villi palatini, muscular uvulae, and platoglossus and platopharyngeus. This is a group of muscles that form the soft palate. This is the roof of the oral cavity. Soft palate, anterolateral, as I said, teeth and gums, posteriorly oropharyngeal isthmus, roof, hard palate, and soft palate. Floor of the mouth or floor of the oral cavity is formed by mucous membrane, mylohyoid, and gynohyoid muscle. Sagittal section, you can see here, this is the hard palate and this is the soft palate. Here is the tongue or floor of the mouth occupied by tongue, and this is the palatoglossal fold. Anteriorly and posteriorly we have palatopharyngeal fold. In between them is the palatine tonsil, sagittal section. Let us move on and talk about teeth. The teeth in the human life, it's like have two processes. In the early life, in the 2 years, they have what's called decidual teeth or milk teeth, and the numbers of them are 20 in MPs. We have central incisor, lateral incisors, canines, first molar and second molars. Total of them are 20. This is called decidual teeth, not permanent teeth. The second group and that continue with the whole life is called permanent teeth, and the number of it is 32. We have central incisors, lateral incisors, canine, first premolar, second premolar, first molar, second molar, and the third molar teeth. And the third molar teeth is called wisdom teeth that could be appear up to the age of 25 years. Anatomy of the teeth. The teeth is formed by three parts. The one what we see is with the neck eye is the crown and the neck and root. The crown, the covered by hard substance called enamel. Inside the enamel there is a dentin and then bulb cavity. The root is covered from outside with a very hard material called cementum, and outside from the root this is the periodontal ligament. Let us move on and talk about the tongue. Tongue is a striated muscle. Is a muscle group. Is a muscle. Tongue is divided by V-shaped sulcus terminalis into two parts, anterior 2/3 and posterior 1/3. At the foramen cecum, located at the apex of the V-shape that divide the tongue into anterior to posterior tab. This indicates the origin of embryonic thyroglosal duct. Part of the tongue have base, body, and apex. This is the epiglottis, apex or the tip of the tongue, and you have two surfaces, dorsal surface and ventral surface. This is a terminal sulcus or sulcus terminalis at the V shape at the joining the two lines. This is a foramen cecum where the embryonic origin of the thyroglosal duct, foramen cecum. This is the oral part or anterior 2/3 of the tongue showing the lingual papillae, and this is the pharyngeal part. It is look like rough part. This is like from the elevation of the lymphoid tissue underlying this is the lingual tonsils. The posterior 1/3 of the tongue, we have the pharyngeal part or posterior to sulcus terminalis, glottoblastal fold by side, and in between them the pharyngeal part. And this is the glossoepiglottic fold, median and lateral, connected to the epiglottis by median and two lateral glossoepiglottic fold. Here is circumvallate papillae anterior to terminal sulcus, and this between the two lateral and median glossoepiglottic fold is a vallicula. This is a devoid lymphoid nodules as lingual tonsil. As I said, is a lingual tonsil. The ventral surface of the tongue has a mucosal fold called frenulum, fimbriated fold, and deep lingual vessels, vein and artery and nerves, and also sublingual fold or mucosal fold raised by underneath by sublingual gland. At the base of the frenulum, some mandibular duct open at the sublingual papillae. Ventral surface again, as you can see here, sublingual duct open beside the frenulum, and this is the lingual vein, lingual nerve, and lingual artery. And this is the more than 4-5 openings of duct of sublingual gland beside the sublingual fold. Is the frenulum, large lingual frenulum. This is interfere with the tongue movement with breastfeeding and speech when it's become short and large. This is called ankyloglossia or tongue tie. This is very important. Some people, they're born with a short and large frenulum that interfere with the breastfeeding and speech. This condition is called ankyloglossia or tongue tie. It's very important. Shortening of the tongue frenulum. Lingual papillae, you already talked about it in the histology session. There are 4 types of lingual papillae: filiform, fungiform, foliate, and circumvallate papillae. The one that anterior to sulcus terminalis, this is circumvallate papillae and can be seen by naked eye, and at this side is the site for taste sensation of bitter substance. At the tip of the tongue and by side is the filiform papillae, and scattered between them fungiform papillae. Filiform papillae, as I said, it contains no taste bud, and fungiform papillae have taste buds. And the 4th type, foliate papillae, that rudimentary in the human being, is also found by side. At the tip of the tongue, you can taste sweet, and behind the sweet, when going backward, you can taste salty material, and by side, you can feel sour substance. And at the base of the tongue, at the side of circumvallate papillae, the site of taste sensation of bitter substance. The lingual papillae again, the largest one, and found like in circle in between the this is the circumvallate papillae, and with the duct in circle with the duct of vaniferous gland. Lingual tonsils, as we discussed, is a collection of nodular mass of lymphoid follicle. Is found in the posterior 1/3 of dorsum of the tongue. Okay, let us move on and talk about the tongue shape and it himself. Tongue muscle. The tongue is formed by 2 groups of muscle, intrinsic muscle and extrinsic muscle. Oral part, the anterior 2/3 of the tongue, and the pharyngeal part, the posterior 1/3 of the tongue. As you can see here, the mandible, hyoid bone, and the floor of the mouth, oral diaphragm, mylohyoid muscle, under beneath above it is the genohyoid muscle, and above it, the root of the tongue is called genoglossus muscle. Here again, this is the extrinsic muscle group are four in numbers. We have the genoglossus as the bigger one and give the muscle its shape. The tongue is its shape. Beneath it is the genohyoid, and behind it, a vertical found is the hyoglossus muscle. Mylohyoid is not a part of extrinsic muscle group, and from genoglossus action, its action is a protrusion and depression that preventing from sinking back and obstructing the respiratory pathway. This is the genoglossus. Genoglossus is the protrusion of the tongue and depression. And according to its position to prevent the tongue from falling back to obstruct the respiratory passage. And you have also one of the strengthening muscle is styloglossus. Styloglossus is the one that draw the tongue backward. It's come from styloid process. This is 3. And the fourth one is the blatoglossus that elevate the tongue approximate to blatoglossus 4. This is the extrinsic muscle group of the tongue. Genioglossus, the largest one, and give the tongue its shape. Beneath it is geniohyoid, behind it and vertical from the hyoid bone to the tongue hyoglossus, and from the styloid process to the tongue is the styloglossus and blatoglossus. Let us move on and talk about teeth. The teeth in the human life, it's like have two processes. In the early life, in the 2 years, they have what's called decidual teeth or milk teeth, and the numbers of them are 20 in MPs. We have central incisor, lateral incisors, canines, first molar and second molars. Total of them are 20. This is called decidual teeth, not permanent teeth. The second group and that continue with the whole life arterial supply of the tongue. The blood supply of the tongue mainly comes from lingual artery. Lingual artery is a branch of external carotid artery. It supplies the tongue by 3 main branches: dorsal lingual arteries group, deep lingual arteries, and sublingual arteries. There is also a small contribution from tonsillar artery branch of facial artery that supply the roof, and the base or the posterior part also there is a small contribution from ascending pharyngeal artery. The nerve supply of the tongue. The innervation of the tongue is divided into 2 parts: anterior 2/3 and posterior 1/3. Anterior 2/3 of the tongue, excluding the valate papillae, which is supplied by the glossopharyngeal nerve, the whole lingual papillae, the rest of the tongue, of the anterior 2/3 of the tongue, is supplied by lingual nerve. This is the general sensation and special sensation or the taste by chorda tympani. Again, anterior 2/3 of the tongue is supplied by one nerve. It's come in combined with one nerve. Lingual nerve, branch of the mandibular nerve, adjoined by branch of facial nerve is called chorda tympani nerve. Lingual nerve carry the general sensation from the anterior 2/3 of the tongue, and the chorda tympani carry the special sensation or taste from the anterior 2/3 of the tongue. Taste sensation, as we said, it's found in the fungiform papillae. Filiform papillae does not contain taste. This is the innervation of the anterior 2/3 of the tongue. Except circumvallate. Circumvallate papillae is found in the anterior 2/3 of the tongue, but it is supplied by the nerves that supply the posterior 2/3 of the tongue, 1/3 of the tongue. Sorry. So the posterior 1/3 of the tongue is supplied by general and special sensation with the glossopharyngeal nerve, including circumvallate papillae. And the part of at the base of the tongue, posteriorly, this is supplied by internal laryngeal nerve branch of vagus. Here the nerve supply of the tongue again, sensory innervation. As you can see here, the interrupted nerve passing through the tympanic membrane. This is the chorda tympani, joining the one of the mandibular branch of the trigeminal nerve lingual nerve and become as one nerve supplied anterior to the head of the tongue. Lesion of the tongue. The tongue muscle, the whole tongue muscle, extrinsic and intrinsic muscle except the glottis, all the intrinsic and intrinsic muscle are supplied by hypoglossal nerve, 12 cranial nerve, motor. This is the motor supply. We talk about the sensory supply of the tongue. So when this nerve is damaged, it's causing tongue to deviate or to paralyze. It's deviate to the same side of paralyzed muscle. On the other hand, uvula, which is supplied mainly by branch of the pharyngeal plexus of vagus, when there is something or damage to the vagus nerve, uvula deviate to the opposite side. Don't be confused. The extrinsic and intrinsic muscle of the tongue are supplied by hypoglossal nerve, except that come from the glottis, which is supplied by pharyngeal plexus of vagus. So when there is a lesion of hypoglossal nerve, it is causing the tongue to deviate to the same side of the lesion. It's very important. And when there is damage or paralysis to the vagus nerve, is causing the uvula to paralyze or to deviate to the opposite side of the nerve, affected nerve. I hope that's clear. Lymphatic drainage of the tongue. We have the tip of the tongue or apex is drained to the submental lymph node, and we have the margin and by side of the tongue. This is drained to the mandibular lymph node. We have the posterior part is drained to jugulogastric, and all this group at the end drained to the deep cervical lymph node.